Years ago, torn ACL was considered to be career-ending injury for a sportsman. But nowadays, recent advancement in arthroscopic surgery and rehabilitation procedure has made excellent chance of returning to previous activity level. To make the knee joint stable, we have two ligaments outside the joints between tibia and the femur. On the medial side, we have medial collateral ligament. On the outer side, we have lateral collateral ligament. These two ligaments control the sideways movement of the knee. Inside the joint, we have anterior cruciate and posterior cruciate ligament. These two ligaments cross each other and they provide anteroposterior, that is forward and backward stability, as well as rotational stability. During any twisting injury or in any sports, any of the ligaments can be torn, including ACL. ACL is the commonest ligament which gets injured in any sports activity. Unfortunately, ACL can't regenerate. ACL reconstruction is a daycare procedure. We have different techniques of ACL reconstruction. ACL reconstruction procedure is a minimally invasive surgery. It's a keyhole surgery. 2 or 3 small cuts are made over the knee. 2 small cuts are made by the side of the patella, that is your kneecap. This is for insertion of camera and the instrument. One small cut is made just below the knee, which is for creating the tunnel in the leg bone, that is your tibia. In the beginning of the procedure, joint is inspected with a probe. A saver blade is inserted to clean the joint and to prepare the footprint for the ACL reconstruction. A probe is inserted to inspect the joint so that other injuries can be identified. For creating tunnel in the femur, we have a special jig which is placed over the femur bone, and a drill is inserted through the femur and the femoral tunnel is created. Another tunnel is created in the tibia bone, that is your leg bone. In most of the cases, we prepare the ACL graft with the help of hamstring tendons. We take out 1 or 2 tendons from the hamstring group of muscles. Most commonly, we take out semitendinosus and the gracilis. With the help of these 2 tendons and strong sutures, graft is prepared. This graft is passed through the tunnels created in the femur and the tibia. The tunnel is created in such a way that it is an anatomical reconstruction of ACL. Femoral side, graft is fixed with a button, and on the tibia side, graft is fixed with a bioabsorbable screw. This screw gets incorporated with bone over a certain period of time. What we have seen is anatomical ACL reconstruction. This is the latest technique of ACL reconstruction. After proper rehabilitation, a sportsman can return to his sports activity after 6 to 9 months.